African American culture. During this presentation, we will take a look at the African American culture, the role this culture has played in the development and history of the United States, and the impact that slavery, segregation, and racism have had on this culture. The purpose of this presentation is to develop a deeper understanding of the African American culture throughout the lifespan so that we're better able to provide nursing care and health care to this population. Because slavery made it illegal for African Americans to read, much of that ideology has remained. Those who were educated after slavery and during segregation had to attend segregated schools that lacked the resources needed to provide better education. Funding of public education is through property taxes. Given that there's a disproportionate poverty and housing discrimination and residential discrimination, little is spent per student in neighborhoods that are predominantly African American. Stereotypes related to poor academics produce a fear of being judged, resulting in lower educational performance. African American community is heavily influenced and affected by racism and discrimination. Those who have experienced any sort of discrimination in the past are more likely to prepare their children for this sort of treatment in the future. African Americans also report lower relationship satisfaction and have higher rates of non-marital childbearing than any other racial group. This culture is predominantly a matriarchal society. However, strong family relationships are present, with uncles, cousins, and maybe even those who are not biologically related, which provides networking, financial, and educational assistance. This culture tends to be very spiritual. As far as mental health, mental illness, and family issues are concerned, African Americans are more likely to seek help and assistance through their church. This has provided positive outcomes for marriages, women's support, and for the family structure. So, how did these attributes we just discussed affect healthcare? The older generation of African Americans may be very suspicious of healthcare providers given their previous history of discrimination, as well as the lack of trust that many of these people in this population feel. They have a holistic view of death and dying, and for this culture, health is often defined as living a moderate lifestyle with cleanliness emphasized and eating a proper diet. As far as childbearing women and families, we spoke previously about this culture having the highest rates of non-marital childbearing than any other racial group. They also have higher levels of maternal and neonatal morbidity rates. Poverty and health-related risk are of concern, and financial and housing arrangements may be stressors for these women, and they often seek support from other women. From a healthcare standpoint, we need to encourage breastfeeding and exercise and emphasize the importance of a healthy postpartum diet. And we also need to provide resources to these new moms out in the community. Higher numbers of women maintain single-parent homes in this culture, and this has some pretty significant implications as far as health is concerned. They are 3 times more likely to be impoverished. 85% of children with behavior disorders come from fatherless homes. 90% of runaways come from fatherless homes, and 71% of high school dropouts come from fatherless homes. As nurses and healthcare providers, our job is to inquire about the family dynamics without judgment and to provide our care with sensitivity to this family structure. Next, we will talk about the African American culture throughout the lifespan. Children from birth until adulthood. For this population, expressions of distress may be misunderstood, resulting in an underdiagnosis of depression. It's important for healthcare providers to identify signs and symptoms of depressive disorders, and important for us to educate the African American community about signs of depression, help families overcome the barriers and stigmas that are related to treatment and seeking treatment, and educate parents and families about solutions and treatment for mental illnesses, and assist them in managing this treatment. During adulthood, a large problem that we see in this age group is pain, and the pain tends to be underassessed for this culture and therefore undermanaged. It would be important for us to develop relationships with these patients and take the time to assess their pain and treat it accordingly. For the older adult, 65 years and older, Resilience and stigma often influence this population in seeking treatment and care. Nurses need to promote independence, facilitate their involvement in the community because family and community are very important aspects of this culture, and include their family and spirituality into their care because spirituality is another major area of importance to this culture as well. To summarize, a sense of community and family is important to the African American culture. Healthcare providers need to understand the importance of independence within this culture, spiritual needs and influences, because spirituality highly influences this culture, the underassessment and undermanagement of pain. We need to educate about mental illness, depression, and treatments. We need to recognize the role that stigmas play in this population and the familial influence on the adolescent population. We need to take into consideration this culture's holistic views on death and dying, and we need to be very aware of our verbal and nonverbal communication techniques and be aware of what our body language is saying to this group.